So he has regular insulin, 4 units in the morning. Okay? That's what the doctor ordered. The doctor also ordered that he has physical therapy and that he gets range of motion or something like that. Okay? So you as a nurse are going, okay, these are the things I've got to do today. So what is the first thing that you've got to do?
You've got to see what his sugar is.
Okay, you've got to see what his sugar is. Good. What else?
His pulse.
Okay, if you've got digoxin, so you need to take a set of vitals. Okay. And what else are you going to do with these medications?
Oh, you can't give potassium.
You have to
Okay.
look at his and if it, like, crushing or anything, like, has to be ordered.
What can't you crush in this packet?
Potassium.
Okay, so what are you going to do as far as time management? How are you going to get all of these things done? You got a set of vitals, you got their blood sugar, now what are you going to do? You're going to call the doctor and get an order for the crush and to make sure it's going to give
The rest of the medication.
Together. Okay, and then what are you going to do?
Prepare your medication.
Okay, you're going to prepare your medications. And you're going to find out when you have to do what? Give them. What time do you give the medication? Okay? So, then you're going to set up your MAR. Anyways, you're going to set up your MAR according to the schedule that you get. If you have one that's ordered every 8 hours, you give it according to the schedule that's their protocol schedule. Some of them start at 7, some of them start at 6, some of them start at 8. Okay, so it's just going to depend on what you want. All right, so after you have done vitals, you have assessed their blood sugar, then what medications are you going to give first, what last, what, would you do the range of motion and all of that stuff before you would give the medications? Would you give the medications first? What are you going to assess for this guy? He does have pain medications ordered, PRN too.
So you give me that 30 minutes prior.
Okay, you're going to assess his pain first, and then you could give pain medication with the rest of the medication, and then go in 30 minutes later after the pain medication has taken effect and do range of motion, right?
Yes.
Okay. See, you guys are already sharper than you were when we did medications. You've got it much better. Okay. So then you have gone in, you have assessed your patient, you've done a set of vitals, you have assessed his sugar, and his sugar is 200. So on your sliding scale it says that you can give over 150, between 150 and 200 you give 2 milliunits, or 2 units of regular insulin. So you're going to go do what?
Get your
You're going to draw up your insulin. Okay, so how do we draw up insulin?
Cloudy to clear.
Okay, here's my NPH and here's my
It's the
regular.
other way, clear to cloudy.
You don't shake them.
Yeah.
Do I shake them?
No,
No,
you roll
I
them.
do. Okay, I roll them. Okay. Now what do I do?
You're going to put air in cloudy.
Okay.
Clean your tops.
Yeah.
Clean your
Multivitamin
tops.
dose.
Okay, so I've cleaned my tops. Okay. Now what am I going to do?
Put air into the cloudy.
Cloudy,
Okay. Do I?
however much
Okay.
you can put in.
So air into my cloudy.
No, you don't touch the liquid with your needle, do you?
If you're
What do I
going to
do?
draw out both of them, you would just inject it, leave
Okay.
it down so you don't
I'm
contaminate
just
the
doing
needle.
what you guys are telling me to
Inject
do.
the air,
Okay, inject the air.
pull
Remove,
it out,
Okay.
drop some more air.
and then inject the other one. And then draw up that one.
Draw up this one.
Yes.
Yeah.
So can it touch this one?
Yes.
Okay. But I'm only given 2 units of regular. Why do I need to drop cloudy?
You don't.
Oh, I thought we were doing a mix, but then just the 2
Okay.
You said
So-
4. Before
Okay,
you
4.
remove your needle, you need to verify with
with
another
the nurse.
Good. You guys? Okay, except that I can't get this air bubble out.
It's okay, it's just.
Be careful, don't bend the skinny needle.
You're right. Okay, so I come over here. Mindy, this is regular
A competent
insulin.
nurse.
2 units.
Thanks,
Excuse
Mindy's
me?
Want me to fix it for you?
Yeah.
Okay,
Yeah.
then
Baby's good.
I take this out. Can I recap this?
Yes.
Well, you can if you do it safely.
Okay.
Because it hasn't,
Safely.
it hasn't been used.
Okay. Now what do I prepare?
Now your oral medications.
Do I need to put these back in the fridge?
Yes.
Okay. So I get my oral medications, okay? Here's Mr. Brown. Is this the right patient?
No.
No.
Okay, let's say it says Joe Schmo.
No.
Is this Mr. Schmo? What else do I need? What do I need to do?
Wash your
I need
hands.
to wash my hands. I need to get gloves on because I'm gonna be touching the pills. Do we try and touch them?
We try to avoid that.
We try to avoid that. Okay. None of these have to be split in half or anything. These are all the exact same, okay? So, what do I do from here?
Just put all the packages into your med cup.
Okay?
Don't you have to split them up, like, one you have to be supposed to?
Well,
Yeah.
you were getting them all at the same time.
But she already did her vitals.
I already did my vitals and I can already give all of the medications. I've already checked my labs because we checked labs, we did that, we did everything. But you're right, if you got their medication first and hadn't done a set of vitals, you would, out of potassium, Lasix, and digoxin, which one would you put in a separate cup?
Johnson.
Digoxin.
And
Potassium. Okay, wait, question. You said we needed an order to crush the potassium.
you got it.
I know, but,
You're not crushing it.
We're not crushing it. Joe Schmo doesn't have to
okay,
scratch it.
that's what I was just gonna ask.
Okay. Nope, he doesn't. Okay, and in your scenario, it'll tell you all of these things.
Okay.
Is this bringing back awful memories?
Yes.
Yeah.
The thing about it is though, is you guys are so much sharper than you were. I mean, you guys,
We're sure
As a
about
group.
it.
yes, as a
Can
group.
this be a group effort?
And we're not under pressure, we're not under pressure.
Okay, so I've got my 3 medications and my insulin. I take my gloves off, did my hand hygiene. I've already done a set of vitals. What else am I gonna need to make sure that this feller has?
Water.
Agua, so that he can drink, right? Okay, so I go into his room, knock on the door, hey, Mr. Schmo, I've got your medication and your insulin. So, what do I give first usually?
Let's do insulin.
Usually non-invasive to invasive is how you usually
Oh, that's right.
Non-invasive to invasive. So you usually give the oral medications first. Okay, each medication, I scan him, scan the patient, I open the medication up, Mr. Jones or Mr. Schmo. This is Lasix. It is for,
Your heart.
Diuretic.
Water retention.
okay,
Edema.
diuretic doesn't mean anything.
Edema, it's for water retention.
This is
It's gonna make you
Even
pee a lot.
body's not gonna work.
It's gonna make you
This is
pee a
for
lot.
your
This
heart.
is a water pill.
water pill.
If you say water pill to these people, registers. But if you say Lasix and diuretic or potty, they'll think it's a laxative.
Oh.
So, okay, this is your Lasix, so have him take that. He takes that. And what are you checking for?
Cheeking.
You're checking for cheeking. Okay, Mr. Schmo, this is your potassium. This is a really huge pill. So take lots of water with it, make sure that you can swallow it. What is your potassium for? Heart, and to replace potassium, which is a
Electrolyte.
electrolyte that's in your blood.
Because of the Lasix.
Exactly. So you're gonna do some patient teaching with each one. Okay. Mr. Schmo, this is your digoxin. This is the medication for your heart. And it's gonna help your heart slow down and
Regulate.
get it, yeah, really good contractility with your heart. Okay, put it in there, have him take it, check for cheeking.
Do you check for cheeking after each pill?
I would,
Okay.
yeah, I would. Because if it dissolves in their mouth, sometimes they can cause sores, because they're really, so I would just check. And you won't get docked if you check for cheeking at one period in time, yeah, so whatever. Okay, then, hey, Mr. Schmo, we're gonna give you your insulin. And I've got an alcohol wipe here. Would you like me to give you your insulin, or would you like to give your insulin yourself? And where do you usually give it? Okay, I usually give it to myself in my abdomen. So you as a nurse say,
I'm gonna
let's
give
give
it
it
to
somewhere else. Yeah. So then we teach him about rotating sites, because you notice that most of his stuff is just right here by the umbilicus. Does teaching need to be done?
Yeah.
Yeah, so you're going to teach him. So I give him this shot. How do I give a sub-Q shot?
15.
Pinch it
Turn
into
the
about
needle
45.
at 9.
Pinch Pinch
Yeah,
2 inches,
go
go to
to
90.
Pinch 2 inches, you go at a 90, pinch 1 inch, you go at a
45.
45. It's easy enough, okay? So alcohol, okay, with the subcutaneous, do I withdraw before I inject?
No.
With an IM, do I withdraw before I
Yes.
inject?
Yes,
With an IM, do I go 45, 15, 90?
90.
90. With the TB, if you had a patient that had needed a TB test,
You go like a
15.
5, 15.
5 to 15. Okay. Are you guys all okay with how you inject, how you draw up, all of that kind of stuff with medications?
What are the sites for the IM?
What are they?
deltoid,
Vastus
Vastus lateralis.
ventral, gluteal.
The hip
Okay,
is
so
the
you've got
ventral
ventral gluteal. Where's your vastus lateralis?
Is your eye.
Is your outer aspect of your thigh.
Okay.
So it's the middle third outside the lateral portion. That's why it's called vastus lateralis. Okay? So it's on the lateral side. Where is places for sub-Q?
Back here.
Stomach.
Back your arm. Don't say stomach.
Abdomen.
Inner thigh? No?
You can do the thighs. You can do the back of the thighs. Where else?
Oh, your handles.
Your back pads and
Shoulders.
Your chubbiness in your shoulders.
2 weeks.
because and the reason I'm not yelling at you, I'm just saying the reason you don't say stomach is these people truly believe you're going straight into their stomach. Like, really? So just say abdomen. If you say abdomen, it kind of hurts me. Okay. Anything else?
Insulin has to be given within 30 minutes of a meal. Like you want
Okay,
to eat within
yeah,
30 minutes. of
insulin
their
should be
insulin.
given within 30 minutes of meal. Okay, after you've given these medications, what are you going, let's say because you know it's going to be, in final pass-outs, you know it's going to be just, like the heart rate's going to be 62 or 61 or 59.
Yeah.
You know that's exactly what it's going to be so that you guys have to make some really firm decisions here. So let's say your heart rate was 62. Would you give the ditch?
No.
Yes.
And then you'd want
You would give it, but then you go back to
Yeah.
Monitor.
You monitor.
You're going to go back in, how often?
And you're gonna look
I'd say
for-
15 minutes after,
Okay.
15 to 30.
You know what I'd do if we had a spare cold socks? I'd probably stick a cold socks on them for the next hour or two, just to kind of watch to see if we're dropping him too, yeah. Not just too quick, but if we're just gonna drop him and he's gonna be, 48 and we're gonna have to.
Oh.
Get some atropine going, bring his heart rate up. Get some
I'm not a
medication.
48 all the time.
If it's below 60, then you hold it and you notify the
So,
doctor and you
if he
recheck
has a
within a
pulse-
period of time.
No, you just hold it for the day.
Oh, you don't call the doctor and he says recheck
Unless
it in
he
an hour.
says, yeah, but by noon his heart rate's usually up, so check it then and then give it at noon. Or something like that, but you're gonna just hold it. You just circle it and say hold, because it was less than 60.
And if it's only 61 or 62, you're,
You still give it.
You
So
still
if
give
it's
it,
60.
but
If it's 60, do you hold it?
if it's 60 and he has, it's gonna depend on his history, it's gonna depend on the doctor, it's gonna depend on a few
So
things.
you would have to verify with the doctor.
I would verify with the charge nurse, and then I would have her say, if you need to verify with the physician and find out if it's something that you need to hold extensively, or if he does, by the time it's lunchtime and he's up moving around and stuff, his heart rate ends up getting to be about 80, and then he has poor perfusion and stuff. Then the doctor always says, you know what, in the mornings it's always low, go ahead and give it. You see what I'm saying? So it's just gonna depend on the patient and stuff with him. So, are you guys okay with medications? That's really all it's gonna be.
I have a question, Jen. How often do you do hand hygiene? Is it in between each administration of the pill?
No.
Or
No.
how you just change your
You need
gloves
to
after?
do hand hygiene before you prepare the meds. Then you need to put gloves on when you're touching medication. Then you need to take gloves off, and I would do the hygiene before and after you administer it.
Okay.
So after you give them oral medications, do you need to wash your hands and put on new gloves to do the IM injection?
Yes.
No.
No?
No. If you've done hand hygiene, you've gotten your gloves on and stuff, you're fine. Unless they puked on you or
Yeah.
sneezed or,
So
Common
you said,
sense when you're,
yeah.
right?
you said when we're doing it, like the heart will probably be around 60 or 59. So do we have to explain all that to you that we
I'm
call
just
the charge
saying
nurse?
that you know that everything is not going to be honky with the patients. They just never are.
So
There's
we just have to
always,
explain to you what we would do. We'd
Mhm.
tell the charge nurse, tell the doctor and all that.
and you guys can bring in your Saunders drug book you know, you'll have an hour, I'll give you guys the scenarios an hour before, if you guys want it. If you guys make the effort to get here, you can have an hour. Huh?
Do we have a
So
schedule?
you'll be
It's
here
up.
at 7:30 tomorrow morning?
Yes,
Is there a schedule?
Well,
Where is the schedule at?
it's posted,
Posted
Is it
online.
under
files,
skills files?
under skills pass-off schedules.
So we have this at whatever time and then we take our test?